Reports this week about a workplace coronavirus outbreak at Amy's Kitchen appear to be misplaced. Jackson County Public Health says today no such outbreak exists at the White City company that prepares organic frozen foods. Newswatch 12 investigated this report to verify the facts with the Health Department, the Oregon Health Authority, and Amy's Kitchen headquarters. Amy's Kitchen says while 10 employees in its White City facility tested positive for COVID-19, in no instance has the transmission been traced to an occurrence within the plant. It also says these cases happened at different times. Oregon Health Authority lists workplace outbreaks, and its new list today does not include Amy's Kitchen. Newswatch 12 reached out to Amy's Kitchen, which released this statement saying that upon receiving notification that an employee is sick, it works closely with Jackson County health officials to conduct a thorough investigation, including detailed contact tracing, taking every precaution necessary to prevent any spread among our employees. And you can read Amy's Kitchen's full statement at our website at kdrv.com. Joining us now to discuss local trends and concerns, Dr. Jim Shames, the Jackson County Public Health. Thanks again for being with us, Doctor.
I'm glad to be here.
As those numbers continue to go up, are we learning any more about the way people are being infected or how they're being infected?
Oh, we're learning a lot every day. I mean, I've just been thinking lately about how we're sort of getting our feet under us. You know, we're much more experienced in contact tracing and case investigation. And so, yes, that's not to say that we've solved this problem, but I do think we have experienced staff. We're working well. And in fact, we've kind of leveled off such that we're really kind of at a plateau. We haven't really seen a steady increase in cases, or rather the trend is not increased. Obviously, every day we have more cases, but the numbers are staying about the same over the last week or so. And I certainly hope that we can continue that trend and or, start moving down in terms of cases per day.
Have we had any workplace outbreaks yet in Jackson County other than the one at Harry and David?
Yeah, so I think everybody needs to understand that the larger the employer, the more likely you are to have cases at your site of business. Stands to reason, if a place like Asante employs thousands and thousands of people, some of their workers are going to become positive. The question in terms of an outbreak is, are they sharing the disease at work? And that's sometimes difficult to determine, and sometimes there's a little of that, but mostly it might just be people are passing the disease on in their household and they're coming to work. To answer your question, in terms of announcing outbreaks, the state does that when an employer has more than 30 employees and they have more than 5 cases associated with an outbreak, and then they announce. But prior to that, unless we think the public is endangered, I mean, we would certainly announce information so the public could keep itself safe. But if we don't do that, it's because we don't believe there's danger to the public.
You did mention that our cases continue to increase. Is that as a result of increased testing?
Well, increased testing does help us get an idea of sort of what we're dealing with. But so, I mean, obviously, yes, if we didn't test anybody, we wouldn't know we had any cases. But it's not creating the trend. Our percentage of positive cases is significantly more than it was when we were doing less testing. So that is to say, we're testing more people and there's more disease in our community. There's no downside to testing that I can see.
I know at the beginning of when we started tabulating this, we had the presumptive case numbers and the confirmed case numbers. Why are those two distinct numbers relevant?
I'm not sure how relevant they really are. Our testing is not as accurate as we'd like it to be, so we miss a certain number of actual cases even when a person's test comes back negative. So, for example, if I had contact with somebody who we knew to be positive and I have all the symptoms of COVID, I'm going to be treated as a positive case. Even if my test is negative, I'm going to be presumed to be positive because the test is imperfect. Walks like a duck, quacks like a duck. It looks like COVID. We're going to treat it like COVID to protect the public and to be sure that we can do right by that individual.
Now, I asked Dr. Shames whether or not that treatment philosophy could produce inaccurate virus numbers. Hear his response coming up tonight on Newswatch 12 at 6 o'clock.